Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. One of the biggest mistakes students make during physical exams has nothing to do with the exam itself. It isn't forgetting a maneuver, it isn't missing a special test, and it isn't getting the order wrong. It's communication. Most students spend hours learning how to perform an exam, but very little time learning how to guide a patient through it. So what happens? You walk into the exam room, you know exactly what you want to assess, but the patient has no idea what you're doing. And that's where exams start to feel awkward, rushed, or less professional than they should. Today, we're going to fix that. Because before we get into abdominal exams, cardiac, pulmonary, neurologic, or musculoskeletal exams, there are a few communication principles that make every physical exam better. Most students think, if I know the exam, I'll be fine. But the patient's perspective is much different. They don't know what you're about to do, they don't know why you're touching a particular area, and they don't know whether something is supposed to feel uncomfortable or not, and they don't know what happens next. So without realizing it, many students start examining before explaining, move too quickly, forget to obtain consent, over-explain, or communicate too little. And even when the exam technique is correct, the interaction just doesn't feel smooth. So the good news is there's a few simple habits that can dramatically improve patient comfort, professionalism, and your OSCE performance. In fact, if you remember only one thing from this episode, I hope it's this. Never surprise the patient. The patient should never have to wonder what you're doing. The goal of good exam communication is simple. Keep the patient informed every step of the way. Everything we're about to discuss comes back to this one simple principle. So today we'll cover 7 physical exam communication rules, 5 common mistakes students make, and a simple principle you can use during almost any exam. So let's get into it. Okay, rule number 1, explain before you touch. Before performing a maneuver, briefly explain what you're about to do. So for example, you might say, I'm going to assess your abdomen, or I'm going to assess the range of motion in your shoulder, or I'm going to listen to your heart and lungs. This does several things. It prepares the patient, it reduces uncertainty, and it demonstrates professionalism. So remember, what feels obvious to you may not be obvious to the patient, so a simple explanation goes a long way. Rule number 2 is obtain consent. So before the beginning of the exam, always ask permission. A simple soundbite could be, I'd like to perform a focused physical exam to better understand what's going on. Do I have your consent to proceed? This should be second nature. It's not just for sensitive exams, but for all exams. It demonstrates respect, professionalism, and patient-centered care. Rule number 3, set expectations early. One of my favorite clinical communication sound bites is, most of the exam shouldn't be painful. Please let me know if anything is uncomfortable. This helps the patient know what to expect, when to speak up, and that their comfort matters to you. It also helps reduce anxiety before you begin. Rule number 4, narrate, don't lecture. As you move through the exam, briefly explain what you're doing. Think of it as kind of narration, not a lecture. This one's hard for me because I like to teach. But for example, you could say, I'm going to assess your abdomen now, or I'm going to listen to several areas of your lungs. Or you could say, I'm going to assess your reflexes. So notice what we're not doing. We're not launching into a detailed anatomy lesson. Patients usually want to know what you're doing, not an entire physiology lecture. So keep it short, relevant, and keep it moving. Rule number 5, give patients time to process what you just said. This is a small skill that makes a surprisingly large difference. So many students say, I'm going to assess your abdomen, and then immediately start palpating. So instead, I would say, I'm going to assess your abdomen, pause for a second, then proceed. Even a 1-second pause allows the patient to process what you're saying and prepare for the next step. It makes you appear calm, more deliberate, and confident as well. Rule number 6, warn before potential discomfort. Before anything that could feel uncomfortable, give the patient a brief heads up. So here's some example sound bites. You may feel some pressure here. This part may feel a little uncomfortable. Please let me know if anything is painful. Patients will tolerate discomfort much better when it's not a surprise. And this simple habit builds trust throughout the encounter. And that brings us to pearl number 7. Watch the patient, not just the exam. This is something I wish more students were taught early. During the exam, don't focus exclusively on the maneuver. Pay attention to the patient. I like to watch for facial expressions, guarding, hesitation, signs of discomfort, and changes in their breathing. The physical exam isn't just about what you're assessing, it's also about how the patient responds to what you're assessing. Okay, so now let's review some common mistakes and how you can avoid them. So mistake number 1, the silent exam. Many students become so focused on performing the exam correctly that they stop communicating altogether. For the patient, silence can feel confusing, so remember to keep the patient informed throughout the exam. Mistake number 2, touching before explaining. Few things feel more abrupt than being touched without warning, so be sure to explain first, give a pause, and then proceed. Mistake number 3 is forgetting about consent. This often happens when students are nervous, so try to breathe, slow down, ask permission, and just make that a habit as part of your routine. Mistake number 4, using either too much jargon or oversimplifying. So there's a balance. Patient-centered language does not mean talking down to patients. For example, instead of saying, I'm going to auscultate your posterior lung fields, you might say, I'm going to listen to your lungs. It's simple, clear, and professional. Your goal isn't to sound impressive. Your goal is to be understood. And mistake number 5 is rushing. I'm certainly guilty of that. Many students know the exam well, but nerves cause them to perform everything at double speed. So one phrase I like to remember is slow is smooth, and smooth looks confident. Patients notice the calm, your examiners like in an OSCE notice your calm, and calm almost always performs better than rushed. So I hope one of your key takeaways from this episode is before every maneuver, explain what you're about to do, give the patient a moment to process, and then proceed. That single habit will improve almost every physical exam you perform, whether you're assessing the abdomen, heart, lungs, neurological system, or musculoskeletal system. So in the next episode, we're going to apply these principles to specific exams. So we'll cover abdominal, cardiac, pulmonary, cardiac, and a bunch of others. And for each one, I'll give you practical sound bites and transition phrases that you can use immediately in clinic or during OSCEs. Because knowing the exam is certainly important, but knowing what to say while you perform it is what makes the interaction feel organized, patient-centered, and professional. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening, and keep practicing. You got this, future doc.